Looking at what's ahead in 2026 for the world of medical innovation. Our medical correspondent, Dr. Darien Sutton, joins us. Happy New Year, Dr.
Happy New
Sutton.
Year.
So let's start in the weight loss space,
Yes.
because we know GLP-1s were such a big part of all the headlines in 2025, including Wegovy, the Wegovy pill being approved by the FDA. What can we expect here in 2026?
I think more groundbreaking research. Beyond what we've understood in terms of the benefits outside of weight loss for these GLP medications, we're learning more and more about benefits for cardiovascular disease and kidney disease. But I think obviously what people are most paying attention to is the weight loss. That seems to be the main point of why people are asking about these medications, and they have been game changers. Right now, what's currently available, you can assume about 15 to 20% of weight loss. Now, that's more than double what you would expect with just lifestyle changes. But with these new generations, upwards of 30% of weight loss. For a 200-pound person, that's up to 60 pounds. And so that can be incredibly significant in terms of helping people to get their goals. But it's not just about finding more powerful medications. It's about finding more people that can get help. And I think that this pill will be a real game changer in terms of cutting down costs, reducing stigma, and helping people start and stay on this medication.
We've certainly been hearing a lot about these different weight loss drugs, and we've also been hearing a lot about artificial intelligence.
Yes.
And this is across industries, right? But in the medical field, can you help demystify how doctors are using this?
You know, this is fascinating for all physicians alike. And I think a lot of the research that goes into it is because there is research that has to understand what is clinically validated. You can't just bring things into the hospital and start using them. I think, first off, starting with imaging analysis. We talk about this a little bit, but for example, with mammograms, it can be sometimes difficult for access to get that radiologist to be able to read that image. But now think of AI able to identify high-risk lesions that can then be directed to a human physician. I say human because you want to make sure to keep autonomy in this.
You still need you.
We're going to have to make sure we identify ourselves.
You are an emergency medicine doc, and so how is AI already changing what you do?
In terms of the burden of the emergency room, right now we are very much a safety net for the community. And so when you see a decrease in access in primary and specialty care, patients land in the ER, and time can be a really, really difficult thing to grab onto. So documentation is really big here. AI is helping to create programs that can help you with documentation. You might not know this. Yes, 90% of my shift is emergency room, hardcore, fast, let's go. But a lot of that is also documenting what exactly we experience. That's so important. So having a tool like this can help decrease that time and hopefully improve patient access time.
That would be a huge help. And I've had the opportunity to report on the advancements in brain-computer interfaces, or BCIs, and a whole bunch of other medical tech, all these innovations and advancements. What should we expect going forward in this space?
When I talk to you about this, these are the most interesting conversations, I have to say, because the thought of your thoughts controlling a computer. Yes, people think about the future of sci-fi, but I think about the patients that can help, those suffering from paralysis, neuromuscular injuries. This is a long way to go in terms of clinical use. Right now, this is very much the research period, probably 3 to 5 years as we've seen. But beyond that, there's other innovations like brain implantation that can help with patients recovering from stroke. So when you look at these outcomes and the possibilities of rehabilitation, I think they're quite significant.
And how special is it to hear from folks who've been working with you and talking to you about the ability to find that connection, that human touch, something that they haven't been able to experience in years?